So we're going to talk about metoclopramide, which is a drug used for vomiting. So what is the mechanism of action of metoclopramide? So metoclopramide is actually a drug that belongs to the same group as domperidone. Okay, so domperidone and metoclopramide, they block the dopamine receptors. Okay, they block dopamine receptors. So they block dopamine receptors, the D2 receptors. So they block the receptors. Okay, block the receptors and also inhibit the dopaminergic stimulation of the chemoreceptor trigger zone. Okay, so we know that we have the area postrema in the brain, and then which is where the chemoreceptor trigger zone is located. Okay, the chemoreceptor trigger zone in your brain. Okay, and in front of this, of course, we have the vomiting center or emetic center. So what metoclopramide does is it blocks the stimulation, the dopaminergic stimulation of in the chemoreceptor trigger zone. So we don't have dopaminergic stimulation of the chemoreceptor trigger zone. So that's what metoclopramide does. Okay, so metoclopramide, there are many brand names. The most famous one is Maxolon. Okay, Maxolon. So what are the indications of giving? What are the indications and what are the reasons why we give metoclopramide? So this is used particularly for PONV, PONV, which is post-operative nausea and vomiting. Post-operative nausea and vomiting. And also we use it for Gastro esophageal reflux disease. Okay, so this is the British way of writing it, or you can write it the American way, Gastro esophageal reflux disease. Okay, so you have reflux of the content of your stomach. Okay, so you have your stomach, so the content from the stomach goes up, okay, and reaches your mouth. Okay, so it's going to cause the distaste there. Okay, your tongue is going to taste feel the taste that is not nice. Okay, because of the reflux. So this is what we call gastro, is the esophagus, gastro, and then reflux. Okay, because of the reflux, it goes up, goes back. It's supposed to go down. Okay, it's not supposed to go up. Okay, there's supposed to be a sphincter here, and then it's going to be, everything should be kept nicely here and then goes down. Okay, by right, it shouldn't go back upwards. So if it's going upwards, this is what we call gastroesophageal reflux disease. Okay, so this is the main manifestation of gastroesophageal reflux disease. And also we can also have dyspepsia. Okay, feeling of discomfort in your abdomen. Okay, indigestion, so dyspepsia. And also we have, it's also used for nausea and vomiting, which are caused by drugs that are used for cancer treatment, cytotoxics, or radiotherapy. Okay, so these are the main indications for giving metoclopramide. Okay, post-operative nausea and vomiting, gastroesophageal reflux disease, dyspepsia, indigestion, and also nausea and vomiting due to cytotoxics or radiotherapy. So before talking about adverse effects, maybe we'll talk a little bit on the preparations and dose. Okay, so we have it's available in the tablet form, which is 10 milligram. Also, we have the syrup form, 5 milligrams per meal. So for example, if you have 10 meals, then you have 10 times 5. So if you have 10 meals, 10 times 5 is 50 milligrams. So you have 50 milligrams in a 10 mil suspension or syrup of metoclopramide. And then of course we have injection. So it's available in injection form. So usually we try to give the injection over a period of 1 to 2 minutes. So what are the adverse effects? So let's talk about the adverse effects of metoclopramide. So mainly what we see are central nervous system adverse effects. Okay, so it's affecting the central nervous system, and that's what we see mainly with metoclopramide. And also we see what we see under the central nervous system side effects are what we call the extrapyramidal symptoms, okay, EPS. So for example, we have acute dystonia, okay, so someone's neck might be turned in one way, okay, in a strange posture, strange position, and these can be treated by stopping the drug and also giving procyclidine. Okay, and also besides acute dystonia, we can have akathisia. Okay, patients, they cannot sit still, they cannot stand still. Okay, they are walking here and there. So these are commonly seen in the psychiatric setting actually, because this drug belongs to the same family and to the drugs that are given for psychosis. So patients with schizophrenia and other psychotic conditions are given drugs from the same group as metoclopramide. Okay, so it's a D2, dopamine 2 receptor antagonist. And then we have Parkinson Leg Syndrome. So they look like patients with Parkinson syndrome. So mainly they become rigid, they become slow, bradykinetic, and also they have tremors. Okay, they have tremors. They are a bit shaky. And with high dose, they also get drowsiness. Okay, they become sleepy. And some patients might develop galactorrhea. Okay, galactorrhea. which is an effect of having excessive prolactin. Okay, so when prolactin goes up due to the drug, so we have galactorrhea. So this is also another common, or you could say it's a known adverse effect of many conventional antipsychotic drugs. So you have hyperprolactinemia, and then you have galactorrhea, which is you have milk coming out of your nipples. So this can be for male and also for females, okay, which can be quite embarrassing for patients sometimes, or all the time. So it depends. So now we'll talk about the contraindications or cautions for giving metoclopramide. So it is contraindicated in first gastrointestinal obstruction. So if you have an obstruction, for example, here you have a tumor, okay? You have a tumor, you have a cancer here, okay? Blockage, maybe because of so many things, can be due to, for example, worms, okay? Parasites, okay? Like the hookworm, Ecata americanus or calostoma, those kind of worms, they can block your gastrointestinal system. So we are not supposed to give metoclopramide in this condition. And also we don't give it 3 to 4 days after intestinal or gastrointestinal surgery. So after a surgery to your gastrointestinal system, we try not to give metoclopramide, because metoclopramide is going to increase the motility, the movement of your intestine, and that might be harmful for your intestine because you're just recovering from surgery, okay? So you don't want to see increased motility. And also a condition called pheochromocytoma, okay? So this is related to the adrenal gland, where you have excessive secretions from the adrenal gland causing hypertension, etc. Okay, so this is a very rare condition, and I've not seen a case of pheochromocytoma in my life. Okay, that's so that's in brief an introduction to and metoclopramide. Okay, see you people in the next video.